talk a little bit because of the video. Otherwise, I'll talk to you and tell you what I'm doing and how it's going.
Yes.
Okay. Right now, I'm just going to clean you. Do you have any allergies to iodine or anything? I'm not using iodine, so it doesn't matter, I guess. Just like this, okay?
Actually, even iodine.
I want to try and get as many as we can. As many as we can with one shot, but we're definitely going to have to do multiple. Little pokes. Nice and superficial. Little burn, right?
I think pain.
Yeah. I want to make sure I get everywhere numb that we're going to do it.
Yeah.
So you'll tell me if you feel any pain,
Yeah.
you know, in those areas, then what we'll do is I'll give a little injection. Now we're just going to start picking up and cutting them off a little bit, okay?
Yes.
Any pain right here?
No.
Well, that's good news. Inside these skin tags, I'm just going to talk. They're called acrochordons, and there's a blood vessel that runs right up the middle of each one of these, so they tend to bleed a little bit. But we will cauterize it with a little stick called silver nitrate.
Oh, that is cryotherapy.
It will be like a chemical type of
Okay.
burn that we do.
That is nitrogen.
When we do the other ones, yeah, it's actually going to be nitrous oxide. It's a little different. It burns colder, and it burns a little better. I'm realizing I don't like these pickups. So give me 1 second. Different. Any sharp?
Oh.
No sharp?
No.
Gotcha.
You cutting?
Yep. I sure am. Some of them have a big base on the bottom. Others don't have a very big base on the bottom. Some of these little guys. No pain?
No.
All right, well, you're doing great. They are small. Sometimes when they're small, they're a little harder to
Oh yeah, I know that.
harder to do, but no, you know, not difficult at all. Just not as easy as big ones. So I'm just going to stop the one that's bleeding a little bit. They're going to look black, okay? And
It will come out later.
yeah, the black is because we're cauterizing it with silver. And when silver oxidizes with red blood cells, it turns black. That's what we're seeing here. Totally normal. Good enough for the moment. Did you have a little funeral for all these little guys?
Oh. We expressed that is the funeral.
They've been with you a long time, you know?
Oh my God. This.
They were so small. How's that?
It's I can patient feel that I'm not.
A little bit?
Yes. Yes.
Okay. My apologies. I'll probably put just a little more there. You're doing really well. So we got a few here. Let me just numb this bottom section here for you just a touch. You probably won't feel this, maybe a touch. Don't move. Any pain?
Little.
Little burn, but now it will be done.
Yeah.
The price you pay for beauty, right?
Oh my God.
Oh my
No,
God.
Oh.
I know, but these get irritated. It's not just beauty, too. They're irritated. They get swollen and painful sometimes in some people.
Yes, because Dr. Ram, he is a health net connection doctor. Primary doctor is left to him. But he said because you are old, so that's coming. So
Well, heck,
that's
you know,
all.
I'm not old and I have them too. Not this many, though. So it does happen with age because your skin's exposed more to these creases and, you know, sure.
So
It's not just old.
I don't know. Insulin make
I numbed up here. No pain here, right?
no pain.
A little bit?
Yes.
A little bit, yeah?
Yeah. You taking out now?
Mm-hmm.
Oh, okay.
This little guy right here just needs a little love with a little bit of medicine. And then there's no more pain.
Oh.
And it happens within seconds. My goodness. Just at the base. The trick is keeping up with all the bleeding. You're okay. There's not too much bleeding, but you know, they like I said, they tend to bleed a little bit.
So
I'm gonna stop here and stop some of the bleeding spots. Oh, you're doing good. Some down here. I think these small ones,
yes.
I'll come and burn them a little bit, okay?
Yeah.
I think they're just too small. I mean, I can cut them, but I think they'll be fine with just burning them, and they are pretty tiny.
It,
Hold on. I tell you, these things just like to bleed.
I should not have omega-3.
Yeah, right.
I should not.
No, you're fine.
It's okay?
Like I said, these have a little blood vessel right in the middle of them. So I didn't use any medicine when I injected you that stops the bleeding.
Oh, okay.
I didn't have any.
Oh.
So it's okay. They just bleed a little bit more. Pretty good. little bit.
Yes.
Let me ask you another question.
What?
Does this one hurt right here? Nah, it doesn't hurt.
No.
Not this one, at least. It's numb.
Y-
That hurts right here?
No. Because you gave what is the anesthesia this side,
Mm-hmm.
it's going.
No, I did this side too.
Oh, really?
Yeah, I'm pretty sure it did. You didn't feel it, so yeah. So you have, lots of little guys over here. I'll see what, I think I'm gonna put a little bit of numbing around the area, okay? And see if I can just do some little shot, ouch. Just kind of the whole area a little bit. Oh. That's a burn. That's gonna be burned off. Most of these are gonna be, it'll be fine, okay?
Okay.
Just try and relax 1 second. You won't need a lot. There we go. That should be enough.
Oh, Doc, I want to. Can you? This is. I put
Let me-
something in the this black
Let me see.
things here.
Yeah.
Daddy,
No, that's just no.
Oh, this can I put something?
No,
and then it's color is there is Walgreen. I saw the fade away. That means I asked them when I put apply that there I did not buy that. Apply here and then this black black marks will going.
I see. Tell me if you have any pain. Close your eyes. Close your eyes so you don't watch me. If you watch, you flinch. Pain?
No.
Done.
Oh, all done?
That one is done.
Mm-hmm.
Just gonna put a little pressure right there. Put a little stick. Stop that bleeding. And then I think we're good. I think I'm just gonna go, I'll see if I can remove a couple of these little guys down on your neck over here.
Uh-huh.
But I really think, turn towards here. Good, I think that's good. You okay?
Oh, little pain?
A little bit.
Yes.
I'm burning you.
Oh, because
It's ice. Yeah, it's like
Yes.
causing frostbite on the skin.
Oh, yes.
Okay?
Uh-huh.
And these will hopefully just scab up and fall off. That's the plan. And you could always come back if we find that there's some more. Okay?
Oh, yes.
You okay? You hanging in there? Bigger one.
It's pain.
I know. It burns. I totally get it. I am going to give you an antibiotic for a few days
Yes.
just to cool it down a bit, okay? Make sure no infection
Yeah.
gets there. I know it hurts.
Oh my God.
Oh my God, I know.
Pain.
Sorry, hon. It's gonna feel like you burned yourself on the stove a little bit.
Oh.
Okay, I still have to do the other side.
Oh, this side?
Just a couple, I wanna have
Yeah,
a look.
uh-huh.
I just wanna have a look, but let me stop the bleeding here. And while I got you, turn over here. There you go. We'll multitask. Here we go. Alrighty. You are doing so well. Like I said, the hardest part about this job, stopping all
Oh, yeah.
stopping all the little bleeding.